Hi, today we'll be talking about vaginal discharge. So a lot of girls, women, they come to us talking about excessive vaginal discharge. So generally, vaginal discharge is meant to lubricate the vagina, and it's a normal part of a female physiology. So why does vaginal discharge happen is that, like I said, it helps to lubricate the vagina, and cells of the vagina which are outdated or which are aged, it's a means of shedding away those cells also. So you don't have to panic about getting a vaginal discharge as far as it is not foul smelling and it's not associated with itching. So like it's normal for girls and ladies to get periods, it's normal to experience vaginal discharge also. Similarly, it is normal to have vaginal discharge. It is physiological. Now, when should you worry about a vaginal discharge and when should you go and see a doctor? So there will be a change in, number one, the color of the vaginal discharge. So normal discharge can be mucoid, it can be whitish in color, but if the color changes to something like a cottage cheese, though it will be white, but it looks like cottage cheese, or you can say fata hua doodh jaisa lagta hai. A lot of patients come and say, they tell us that this is the kind of discharge that I'm experiencing and it is associated with itching. Then you know that it is abnormal. So this is number one, when the color changes. Then the discharge can be greenish. So you may experience that the color of the discharge is greenish, or it can be grey, and it can be, sometimes it can be brownish as well. So when there is a change in the color of the discharge, second, there can be change in the consistency of the discharge. So like I said, a normal discharge can be watery or it can be mucoid. However, if it becomes sticky and if it becomes frothy, you can actually see the discharge becomes frothy. So you know there is a change in the consistency. So there's intense associated with discharge, then you know that it is time that you must go and see a doctor. Now let me explain what are the different reasons why the discharge happens. So the first can be a yeast infection. Yeast is basically a fungus, and fungus likes humidity. Whenever there is wetness, the fungus will flourish. So it's okay to wet yourself or clean yourself after you've used the washroom, but it's a good idea to dry yourself, because if you leave that area wet, it becomes humid, and then that's a media for the fungus to grow. So for people who sweat a lot, there's again dampness, so that again is a factor why women develop yeast infection. Other reasons for yeast infection could be if you are on oral contraceptive pills, or because of some disease you are on steroids, or if you are on antibiotics. So a lot of times women experience itching which starts after taking antibiotics, especially long course of antibiotics. So these are the reasons why you develop yeast infection. Now the second type of infection which can happen is called a trichomonial discharge. It's called a trichomonial vaginitis. It's caused by a protozoa. So in this, the color of the discharge changes to greenish. It's associated with intense itching, and we give you medication for the same. So normal, the pH of the vagina is acidic. If for some reason the pH of the vagina changes, then it becomes more prone to develop infections. So the second type of infection is a trichomonial infection. The third type of a discharge is a bacterial vaginosis. So this will produce a greyish thin discharge, frothy, intense itching. Now bacterial vaginosis is sexually transmitted. So if the doctor feels that you have bacterial vaginosis, then the treatment is also given to the partner. Because if we just treat the woman, we don't treat the partner, then there is a chance that if you have intercourse again, you will develop the infection again. Now this is nothing serious. This is like any infection, just that this is a vaginal infection, and which can be treated with antibiotics. But for some, it's just you who requires treatment, and for some, the partner also requires treatment. And in my previous videos, I've already talked about sexually transmitted infections. Now STIs can also produce discharge, and sometimes STIs can be asymptomatic as well. So if you're sexually active, you're more than 25 years of age, then it's a good idea to go to your doctor and get an annual STI screen done. So these were the different types of discharges. Thank you.